My name's Elly. I'm one of the public health doctors at the North Eastern Public Health Unit. Safe sex is about having sex that's enjoyable, respectful and protected from both disease and any unplanned pregnancies. When we think about protection, we often think about using barrier protection such as condoms, because that prevents us from both sexually transmitted infections and unplanned pregnancy. Protection also involves things like getting regular sexual health checkups with your local doctor and vaccinations. So it is never fully safe to have unprotected sex. Some people have sexually transmitted infections and don't have any symptoms, so there is no way to know for sure. So we'd always recommend using barrier protection. There's also always a small chance of getting pregnant without using contraception or barrier protection. So we would say there is no time where it is safe to have unprotected sex. Whilst you absolutely can have sex whilst on your period, you do need to be mindful that you still are at risk of unplanned pregnancies. That's because some people have irregular cycle lengths. You might be ovulating a few days after you have sex. And we know that sperm can live for up to 5 days. So whilst there's no reason why you can't have sex while on your period, you do need to be mindful of unplanned pregnancies and still use contraception or barrier protection. So it is important to still get STI tests while you're using condoms, and that's because we don't always use condoms perfectly 100% of the time, and they only protect the skin that they're covering. Important STI tests that we routinely do, so we usually recommend everyone gets a test every 6 to 12 months, and that's for some of the common STIs like chlamydia and gonorrhea, but your healthcare professional will talk it through with you each time. So there is a treatment available for gonorrhea which cures it. It's antibiotics. Usually you get an injection and you take tablets as well, and then you should be cured. So the most common symptom of chlamydia, especially in females, is not to have any symptoms at all. Otherwise, some symptoms that people experience is abnormal discharge, either from the penis or the vagina, urinary tract infections, abnormal bleeding in females, such as bleeding after sex, and sometimes people get some pain in their tummy as well. If you do notice these symptoms and you're sexually active, the GP will recommend a test for chlamydia, and there's a couple of different types of tests. You can have a swab or you can do a urine test as well. So HSV-1 and HSV-2 are two different types of herpes. HSV-1 infects both the mouth, which is typically cold sores, and the genitals as well, whereas HSV-2 only affects the genitals, and similar can present with kind of some sores in that area.